Hi, my name is Melissa Resch. I am a nurse at Aspirus Wausau Hospital, and I work on the COVID medical unit. It has been quite an experience. We started off small scale, seeing patients who are being ruled out for COVID, and now we're seeing they were walking, talking, independent. Now we're seeing people high amounts of oxygen, needing to be repositioned, needing to be intubated, needing to be on large amounts of oxygen. And N95 masks do not absorb tears when you are at a bedside, removing somebody from a BiPAP, letting their family FaceTime them to say goodbye, and you sit with them as they take their last breath. It is not something that I ever thought that I would be doing as a nurse during a pandemic, and we're seeing it more and more frequently.
My name is David Eggman. I'm a nurse. I've been a registered nurse for 20 years. I've worked in ICUs for 20 years. Since April, I've been volunteering in the COVID ICU. We had it pretty darn easy in April, May, June, and July here in Wisconsin, north central Wisconsin. Since August, it's gotten bad, and it's getting much worse. We have many patients who have come in here, and their last words before we put a breathing tube in are they didn't realize it was as bad as it was. They thought they were doing what they could do to protect themselves. We've had several people come in here and be very sick that all they did was want to see their grandparents. I'm a grandparent. I would like to see my grandchildren. This is larger than that. By wearing a mask, you're protecting them as well as yourself. Please, if you do nothing else, please start wearing masks. Thank you.
This has been a really crazy time to be a nurse, especially an ICU nurse. In the beginning, in the spring, we had tons of support from the communities. We had the Blue Army, hashtag Blue Army. We had people, putting blue hearts in their windows and blue porch lights on. I still have mine on. And then, over the summer kind of slowed, and now we're at the part where we've never been busier. We've literally never been busier, and I think for the most part, the community has still been supportive, but I feel like we're kind of falling off a little bit with our support, and I think we really need the support. It's hard walking into these shifts every day or into the hospital every day, seeing some of these people just not progress, seeing multiple deaths, multiple days in a row. It's really hard to try to stay positive when the community itself isn't really got your back. There is some people who have been really resistant to the whole COVID world. They don't believe it exists. They don't see what we see. There's nothing political about these people dying.
There's nothing political about these people dying. Those healthcare workers from Wisconsin, of course, one of the states is having a really hard time right now. The state's seeing record numbers of cases and hospitalizations, some hospitals being stretched dangerously thin in Wisconsin right now. But it's all over the place. Nearly 30 states have seen more than a 25% increase in case numbers in the last 14 days. In Utah this weekend, the largest hospital in the state overtopped its ICU capacity. That hospital drafting in overnight overtime doctors and nurses for their overrun ICU as they scrambled to convert other bed space into intensive care capability. North Dakota continues to have an incredibly difficult time. North Dakota ranks first in the country for the number of new cases per capita, and it's just been an inexorable rise in North Dakota these past few weeks. Today, that state recorded its 12th straight day of active cases reaching a record high, 12 days in a row. North Dakota's governor, of course, has resisted instituting any sort of statewide mask order because he keeps saying it wouldn't matter, that people wouldn't follow it even if he did it. Well, tonight, Fargo became the first city in North Dakota to implement a mask mandate. In South Dakota, where the Republican governor there has refused to order any statewide COVID restrictions, after record numbers of cases and hospitalizations, the mayor of Sioux Falls, South Dakota today is urging residents of that city to, quote, wear a dang mask, saying he needs them to do more. If they're not going to do anything at the state level, he's got to do something at the city level. States across the country are breaking just record after record at this point as the president continues to downplay the virus. Today, he called Dr. Anthony Fauci and other career scientists involved in the U.S. public health response. He called them idiots. as much controversy and scandal as there is on this at the federal level, on the front lines in the states and in our counties and cities, healthcare workers are fully engaged right now. As much nonsense and fighting over the disastrous federal response, on the front lines, the healthcare workers, the doctors, the nurses, the pulmonary specialists, the housekeeping staff, the people who are dealing with the COVID surge into our hospitals, those folks are more engaged on this than ever before. And they are doing it now still without any federal leadership, but also now in a lot of cases without the kind of community support they used to get earlier this year. Joining us now is Dr. Paul Casey. He's the Emergency Department Medical Director at Belen Hospital in Green Bay, Wisconsin. Dr. Casey, thank you so much for taking time to be with us tonight. I appreciate you stepping away to talk with us.
Thank you, Rachel. It's an honor.
We've seen some testimonial sort of video diaries from some healthcare workers at Belen. We've seen a lot of reporting about how resources at the hospital have been stretched to accommodate this influx of patients. What do you think the country should know right now about how things are going in Wisconsin and how you all are coping with what has been a really steep rise in cases?
So we are currently experiencing an amazing rise in coronavirus cases over the past month. We didn't really have a second wave. We're in the middle of our second wave right now. And on Friday, we had 3,800 new COVID cases in the state of Wisconsin. We know that 6% of COVID patients will ultimately need to be admitted. So that means in 7 to 10 to 14 days, we're going to have 228 patients from a single day who are going to need hospitalization in a state where our bed capacity is already close to being maxed out. I've been a doctor for 34 years, and I have never seen the amount of suffering I've seen in a short period of time. I've never seen in my career a time where an entire ward, 20, 30, 40 beds, is filled up with patients with the same disease. People try to compare COVID-19 with influenza. We admit more patients per day for COVID-19 pneumonia than typically we admit in a whole influenza season. This is not at all like influenza.
You talk about 20, 30, 40 patients all in the same ward, all suffering with the same serious illness. When we saw the kinds of peaks that we saw early in the pandemic in New York and New Jersey and in the Northeast, when things got so bad so fast for those hospitals, the whole country got concerned not only about the pandemic taking off, but about the toll it was taking on healthcare workers, them putting themselves at risk and them working themselves to the point of exhaustion. Doing that in February and March, when this thing was brand new, almost feels like a different ask than asking healthcare workers to do that now in October, when it has been a year of stress and a year of building and a year of dealing with at least some amount of this. I can't imagine. You and your colleagues must just be exhausted. It must be hard to keep up the pace.
We are starting to get tired. However, healthcare workers are troopers. We're in this to help people. We do whatever we can to help anybody. So the big difference between the first wave and the second wave, at least in our community, is during the first wave, we shut down our entire hospital. We canceled clinics. We stopped doing elective surgery. So we had tremendous capacity and more healthcare workers to care for these COVID patients. What we learned from that, however, was that people suffered from that. They didn't get their colonoscopies, their breast cancer screening, their hip replacements. And so in May, we opened everything back up to full service. So we no longer have extra staff to pull in to care for COVID patients when we're short, because all the staff are doing their usual job. So we're taking care of those 20, 30, 40 COVID patients in addition to a full hospital capacity. That's the big difference, and that's why this time it's so different.
Do you think that you're in a situation in Wisconsin where you're going to have to put out the kind of call for assistance that New York did, for example, early on, that you're going to need to call in additional staffers to bring in people from outside your usual catchment area in terms of bringing on new staff?
We hopefully won't get there. We have planned out 3 different scenarios for expected COVID patients based on the R0, the number that predicts how many patients will get infected. And we've already had to start using some traveling nurses and respiratory therapists And the other problem is that we have patients out on, not patients, but healthcare workers out on quarantine because they themselves have been exposed to COVID. So we hope we don't have to go there, and we're preparing to not do that, but we may have to go there.
Dr. Paul Casey, Emergency Department Medical Director at Bellin Hospital in Green Bay, Wisconsin. Sorry, you and your colleagues, I know, are working harder than is possible. Thank you so much for your time tonight.
You're welcome. Thank you.
All right, we got much more to come tonight. Stay with us.